So there are many things we are not using, still we are learning. Okay, just because it is there in the syllabus.
Because you have thousands of people looking at you, you have the player down, and particular tense situation, if you mess up with the diagnosis, then you are gone.
So choose what your heart says. Okay, because your entire life you will be doing that specialty. You'll have a stamp that you are an orthopedic physiotherapist or you are a cardio.
Good evening, sir. Good evening, ma'am. We'll start by introducing you. Could you please introduce yourself, sir, and then ma'am?
Okay, my name is Dr. Sibi Joseph. Yeah. So I'm specialized in orthopedics manual therapy. I've done my PhD in physiotherapy, and currently I'm working as a professor with Lokmanya Medical College of Physiotherapy, Kharghar.
Ma'am.
I am Dr. Rincy Sibi Joseph. My specialty is musculoskeletal and sports physiotherapy, and I have been working in Y.M.T College of Physiotherapy, Kharghar.
We know that quite well, ma'am.
Sir and ma'am, were you always interested in teaching?
Yes, teaching was my first love. Yeah, I wanted to be a teacher, whether it is physiotherapy or any other field, but I wanted to be a teacher. If not physiotherapy, then maybe I would have been a teacher in some science college, biology or something. Yeah.
Teaching is my second love. I've always loved clinicals more than teaching.
She's more into clinicals. I like teaching. Yeah.
So you balanced it both by doing both.
Yes.
True.
Yes.
Ma'am, so the next question is, by now we have met a few people and almost all of them say that our physiotherapy syllabus is quite out of date compared to what we, actually practice, do in clinical practice. So what are your views on that, and what do you think should be changed in the syllabus or that is taught to us?
See, talking about the syllabus, if you ask me, yes, definitely the syllabus needs to be revised because see, there are many things what we are not using currently. Okay, and then if you compare with the syllabus with other foreign universities also, so it has to be updated definitely. Like many things like suspension therapy and all, it's totally outdated. Like, so we hardly use that anymore. Like, so there are many things we are not using, still we are learning. Okay, just because it is there in the syllabus. Okay, ऐसे बहुत सारे points हैं where you have to change. Okay, but then see, the decision is board of studies. They will take a decision, so they have a meeting and then they will decide MUHS. But definitely syllabus needs to be revised. It has to be more updated, and more research oriented. Okay, more evidence based practice is required. That's what I think. That's my opinion. Yeah.
So that is what you would like to add, like research based more into the syllabus.
Yeah, it has to be more evidence based. Like, okay, what does the evidence say, and what do you practice? That is more important. We do something which is not there in the which is not evidence based. Still, we are using it. Okay, that way. So it has to be revised definitely. That's what I think so.
Ma'am.
Basically, what we think is, all of us know the techniques. Every one of us are learning different techniques, but when to use that particular technique is not known. So that is where the research plays a role. That is where your recent evidences play a role, and that is where more of our syllabus should be concentrating. But again, that depends on the board of studies. They have to decide on that.
How much time would it take to change the entire thing according to you both? Do you see it coming in your future or not?
Change the syllabus.
Like the changes that are required.
Make the advances, yeah.
I think it will take time here because see, it's not one person cannot decide that, right? So it is like from MUHS, it has to be a board of studies decision, like, so it will take time. Maybe in the next 5 years something should happen. Yeah. Let's see. Yeah, hopefully. Yeah.
A lot of students have question as to what exactly is manual therapy. So if you could highlight what it is exactly, that would be helpful.
See, manual therapy is nothing different, but it's a part of orthopedics only. So I did my masters, both my bachelor's and masters from Manipal. Okay. So in Manipal we had a specialty as orthopedics. It was not called as musculoskeletal. It is called as orthopedics. And under orthopedics, we can choose 3 electives. So one is manual therapy, one is hand rehab, and the third one is sports. Yeah. So I have taken manual therapy. So manual therapy, we have 2 papers. One paper is only manual therapy, wherein you have different schools of thoughts of manual therapy, and then that's a 100 marks paper. And then you have a separate subject as orthopedics. So that is the general orthopedics, in where you cover everything. So manual therapy is basically all your techniques, what you use, all your mobilization techniques, mobilization manipulation techniques, and you have different schools of thought of manual therapy, like McKinsey approach, Maitland approach, Mulligan techniques. Okay, so these are different schools of thought. So basically, you need to know when to apply what technique. That is important. Okay, so and it's more of hands-on manual therapy, and you have a lot of clinical reasoning involved in that. So that is very important. Clinical reasoning part is very important in manual therapy, which we normally don't do much in general orthopedic practice, because that is more protocol based. And manual therapy, you have to diagnose cases. So it's like solving a jigsaw puzzle. Like, you have to like find out what is the source of symptom. So you have different hypothesis categories. So that we need to find out. So it's a wide subject. Like, yeah.
Why did you select that to do in manual therapy?
Why I did in manual therapy? See, because I was very clear after my bachelor's, that if I will do a master's, I will definitely choose orthopedics only. So orthopedics was my first choice. I was very clear in my mind. I never wanted neuro or cardio. Okay, and basically I think I developed an interest because of my teachers, because we had really good teachers in Manipal for orthopedics. So I was quite impressed with my teachers, and that's how I started developing this love for orthopedics. So I was pretty clear I want orthopedics only, and under orthopedics I was like sports I never wanted, because on field I was not very much keen. Okay, so I was like either manual therapy or hand rehab. So manual therapy was my first choice. So I had good marks in the entrance. So that was in demand that time, manual therapy. So I got manual therapy. So that's how, because I like to treat a lot of spine conditions, and manual therapy plays a major role in spine conditions basically. So that is one reason.
So till now we have whatever episodes we've done till now, in every episode Manipal University has come up as one of the best universities or something like that. So what is different in Manipal that is not in other universities, that everyone says Manipal as the name that comes first to their mind?
See, basically I'll tell you one thing. Manipal, it's a small town. Okay, so it's like a base where the teachers are staying in the campus. Most of them live in the campus. Okay, and then so we have a hospital attached. That is the most important thing. You get to see variety of patients. Okay, we have a big hospital, KMC. So we attach to KMC. So variety of cases we get to see in all specialties. Let it be ortho, neuro, or cardio. And then we have teachers who are dedicated. See, nobody has a private practice there. So everyone is focused only into academics. So teachers are also totally dedicated, only academics, and then they do research. And we have a beautiful library in Manipal. So I think I've not seen a library better than that anywhere in India. Okay, maybe AIMS might have, but then otherwise private institutes, Manipal has the best library. And ultimately what you need in PG is all self-learning. So you have patience and you have resources. You have good resources, like because we have enough number of books, we have latest journals, we have lot of journals we have. So the latest evidence we can find there, and plus the patient exposure is very, very good. So I think that's why I think Manipal is the best place. Private institutes, if you want to study physiotherapy, I will definitely recommend Manipal.
So for now, what is the process of getting into Manipal University? Like, it is a private, so is there a private entrance exam for that, or is state exam considered for admissions?
No, Manipal has its own exam. Like, so they have, I think they have a private exam. Yeah, they have Manipal entrances there every year. Yeah, like all the deemed universities. It's a deemed universities. Yes. Right.
Sir, and apart from Manipal, which are the good colleges in India for manual therapy?
Manual therapy, see, I'm not aware whether any other college is giving specialty. Cayley gives. Cayley Belgium has a specialty in manual therapy, and Manipal has. I'm not aware of any other college where they have a specialty, because even in MUHS you have musculoskeletal. There is no specialty as manual therapy in that. So I think Manipal and Cayley Belgium is there, as far as I know.
And ma'am, you have done your masters in musculoskeletal and sports. Why did you choose it?
That's what I was just thinking. We are just opposite poles attract.
Yeah.
He hates going on field, and I love going on field. Okay, that is one reason. Plus, Bangalore offered both the courses together. So why not was my question. Like, musculoskeletal and sports has always been my favorite. And going on field is like icing on the cake. You get to learn many things on field, off field, and sports has always been my favorite part of the thing. Where you enjoy as well and you learn also. So both things combined together, nothing like it. So I've always wanted sports and musculoskeletal. Musculoskeletal just came up as an add-on, but sports is something I wanted. And since I had done my UG from Bangalore itself, so I thought I'd continue there itself.
As you mentioned, you love to be on the field, but there are certain qualities which you require. Like you have to take instant decision if a player is injured.
Very true.
So what are the other qualities which you require to be a sports physiotherapist?
That is what a sports physio's talent is seen on field. If you're good, the 2 minutes will decide that. And the player will decide that as well, because you have only 2 minutes on ground to assess, to diagnose and to treat, which is very difficult because you have thousands of people looking at you. You have the player down and you need to you have to actually concentrate on what is happening. So then in that particular tense situation, if you mess up with the diagnosis, then you are gone. So that is the time actually your talent is recognized by 1,000 plus the player who's going to stand up back and play the same sport again. Because everything is dependent on your decision. So that way I think a sports physio has much more job than others where result orientation, you have only 2 minutes for a result to happen. Others we have a day, let's say we give them 5-7 days of rehab. But a sports physio has only 2 minutes. So that way your skill is
so it's more challenging, I feel.
Yes, true.
It's more
Very much
challenging.
challenging.
Ma'am, with what mindset do you go to the athlete? Because you can perform all the special tests and find out what exactly the injury is and you have to give treatment accordingly.
The mindset is actually you keep on focusing entirely on the game. You cannot lose your focus because you may never know when the injury is happening. That is everything. You have to just focus on each and every player. Who's playing, what is playing, and the mode of injury will tell you exactly what the diagnosis is going to be. So that way, that is the only thing that can help that last 2 minutes actually.
So, ma'am, you both have experienced both the academic side and the clinical side of our profession. So, according to you, which is better and why? Like, what are the pros and cons of each?
And to add on to this question, how to decide to whether to go to academics or clinical practice? Because some people do have interest in academics also, but they have the fear okay, what if I can't do it? What are the qualities which are required to be a professor?
Yeah, I think that's a very good question. How do you decide whether you need academics or clinicals, right? See, it's person to person, it will vary, right? So not everybody can teach. Okay, even if you have knowledge also, it's difficult to pass the knowledge and explain someone else. That itself is a talent. Okay, so you need to simplify the concept and then make them understand. So that is quite difficult. So I think you should introspect yourself, and then you should you come to know which is your line of interest, whether you like academics or clinicals. See, clinical also is not very easy. See, both has its pros and cons. Academics, you should know how to pass knowledge and teach someone, your students. And clinicals, you should know how to deal with patients, okay? Because it is not very easy to deal with patients also. You need a lot of patience and your clinical skills. Some people are very good, okay? So if you think you're not a very good teacher, maybe you can be a good clinician. It's quite possible, okay? I've seen many people, if you ask them, we cannot explain the concepts to you, but they will show results on patients, okay? So those people can opt for clinical. But both have its own pros and cons. Yeah, pros and cons. And academic is totally different. The kind of job what you do is different because you have a lot of administration work, and then you have a lot of taking exams, paper corrections. So it's a total different line altogether. Okay. And in academics, you get to be in touch with your subject. That's one thing. You get to read if you like reading a lot, if you like doing research, okay. So academic is one area, because clinical में what happens, like once you finish your graduation or your PG, you will. It's very rare that you keep on updating yourself. Academics mean you get that chance because you are working in an institute where you have a lot of books, a lot of resources, so you can keep on updating. But clinicals mein that is a challenge, or maybe you'll have to attend some workshops. So research is question in clinical side. Academically you can do a lot of research and you can be updated. That is one thing. And academics mean you get to be with your students. Okay, you can work with youngsters. So you don't feel that you're becoming old. That's one thing, yeah. That's one advantage I feel. You're always with students. Yeah.
I think one is more of mental stress and one is more of physical stress. Academics means totally you are mentally strained, stressed, everything. But clinical you are totally physically strained than mental stress. That way I think that is the only difference which I find. Which stress you prefer is what you take.
In your case, you're managing both of them.
Yeah. So we have both now. Right? We have both mental and physical stress. Yeah.
That is actually the next question, ma'am. How do you manage everything? You have your go to your colleges and also have your clinic. So how do you manage all? And you also have a personal life. So how do you manage everything?
Like how do you balance your professional and personal life?
We have a very good back support actually.
So
it
this
is not just us, it's our parents and everyone who's actually backing us up. Otherwise we would have definitely, it is difficult for a mother as such to manage everything, but our back support is quite strong.
Yeah, that is definitely important. And then it's not easy to balance. Definitely, if you ask me, it's not easy to balance because you don't have time for yourself. Because you work in the college, then you come back and you work in the clinic. So by the time you get back home, it's almost 10:30. But then see, you have to pay a price for everything. So you have to really work hard initially. So these are initial years like. So I think we need to put up a lot of hard work. So let's see, hoping for the best. Yeah.
In both our places where we work, be college or our clinicals, we are happy. There is, we are not in a stressful environment where let it be Y.M.T or Lokmanya and our clinic. We are happy. So that way, happiness is also balancing everything. So the stress comparatively is not that much. That is what I feel.
Yeah, but time constraint is there definitely. We don't get time for ourselves. That is true. Yeah, but then Sunday is the only time we get
That is same for us also.
Yeah.
Yeah, as students also. Yes,
yeah.
as students.
But at least evening time you guys are free, right? You all do home visits.
They are never.
YouTube videos.
What are the basis of judging, or what are the criteria required for getting, on what basis do they hire as a professor or as a teacher in academic setting?
See, in academics, if you ask me, the basic requirement is masters. Because even if you want to join as a lecturer, earlier they used to take even BPT students as tutors and all. But now that post is not there anymore. So the first job what you get is like a assistant professor. And for that you need masters. MPT is the minimum criteria. Your college doesn't really matter, but then the degree, you should have a MPT in that. Then maybe if you have a competition, then they can decide. No, it depends. So otherwise, the college doesn't really matter, but it depends. Your knowledge will matter. But otherwise, you need a MPT. Basic MPT is required to join a college.
You basically need your degree. Okay, you need a good skill to make the person understand what you're trying to say, or whether your particular thesis is published or not. If published, it should be in a good journal. Okay, then what you need is actually what you guys have faced is a demo lecture. I hope you face that.
Yes,
where you review us, because you are the better judge to tell whether the concept is understood or not. So yes, so it is always
students' feedback is taken.
Feedback
Actually.
that is important. So the way you deliver, the way you make the concept simplified, is what makes you a good teacher. If I tell exactly what is from the textbook, that means I'm reading a textbook. That even you can do. But if I'm able to make you understand the concept of it, then that makes me a good teacher. And that is what you judge, and not the other people. If you give us a good review, then only the process is taken up further. If the review from the student itself is bad, then there's no point hiring a good teacher. No?
And then truly I feel that like if you don't have a app for teaching, it's better you don't join as a teacher. Just don't look at the money part of it. Okay, because I've seen a lot of people joining just for money purpose, because you get a good salary, so you want to join. But then you need to have a flair for teaching also. If you do not like teaching, you're going to spoil the life of other 50 students, right? Because teaching requires a lot of efforts. You have to prepare a lot. Okay, clinical में ऐसा नहीं होता है. Clinical is like whatever knowledge you have, you just apply on patients and then you see the results. But teaching requires a lot of preparation time. You need to make your PowerPoint. Reading is required. Okay, so if you don't like doing so much of hard work, better don't be a teacher, because you're going to spoil the life of 50 other students. Okay, because whatever teacher says, you believe. See, for me, if you see, whatever my teacher has taught me, even till now I practice that. So we are fortunate that we have got very good teachers in Manipal, and I really owe to them. Whatever I am today, it's only because of my teacher. Yeah. But then nowadays students are joining just for the sake of money, so that flair is not there. So that's
what happens is we actually set a bad example for you.
Yeah.
Where automatically then negativity comes in, ki whatever happens, we are not joining into teaching.
Yes.
Because you, right from childhood, be it you or be it me, we have taken our teachers as role model. And if you have a bad role model, then your entire career is ruined. So if anyone has the flair for it, go for it. But if you want just the money sake, you are actually spoiling the entire batch.
Not only physiotherapy, any other profession, but if you want to be a teacher in any field, you should like that thing. Otherwise, there's no point joining it, because whatever a teacher says, 50 students are going to listen to that. Okay, and they will follow the same thing. So it's a big responsibility.
Yeah.
What you're going to, even one word you utter, it cannot be wrong. It has to be right, whatever you say. So that is very important.
As you mentioned, ki some people only join just for the salary. So is it more than what you get in clinical practice as a consultant physiotherapy? Can you tell what is the average salary?
The scales have improved now. So teaching, depending on the college where you join, which city you work, so it all matters. But definitely, I think still teaching has an upper edge compared to clinical side. If you join a hospital immediately, so then maybe I think a lecturer will get more salary. That's what I think.
Can you tell an average amount?
See, that depends again, hospital to hospital, colleges to colleges. So the average would be actually maybe a difference of 5,000. That is it. Not much, but again I said the physical stress and the mental stress. Which one you prefer is what you actually go for.
Ma'am, sir, could you tell a little more about your clinic and what struggles did you face in order to open it, and what are the problems that you're facing right now, like anything, if anything?
See, first of all, the big struggle was to find a place in Bombay. That was the biggest struggle, I think. Yeah, initially, because I had this in mind to start a clinic, but then to get a place and within our budget, so all these things was a big struggle initially, and finally we were lucky to find this place, and then we could start, because a physiotherapy clinic, I think, needs space. That is very important. There is no point opening a small clinic. So my idea was always like you to have a decent amount of space should be there, because ultimately you want people to come and do exercises. That is the main thing, right? You're not prescribing medicines and giving patients. So for a physiotherapy clinic, I think space is the most important thing. So that was the main concern, because wherever we went, either the place is small, or we were not liking it. So finally, this is one place which both of us agreed on. Actually, we were like, okay, this is fine. Yeah.
And of what we've seen, it's really amazing.
Yeah.
Ma'am, anything you want to add?
See, our clinic, we are looking into specialization. Like he is into pure spine. I am into pure MSK. So when a neuro patient comes, a patient with stroke comes, we have a specialty who sees neuro. We do not go and see that, because we have limited knowledge. Our knowledge ends with that. It's quite limited. Where a PhD neuro can do a better treatment than us. So that way, if you see, that is one good point about our clinic where we have made sure that it is according to specialization only and not कि we take up all patient, come in, we'll see you, give you general thing. No, we don't do that. The hardship what we are facing is we have people around who's like every specialty is seen by one person or not trained people. That is a problem. Then the mindset, to change the mindset becomes a problem because still there are people practicing traditional approaches and no one is going according to the evidences. As said, ki when you are in academics, that's the best point, ki you are in touch with the recent evidences, and clinical side you are not in touch. So we are in touch, so we are going according to evidences. So then there is comparison कि वहाँ पे ऐसा किया था, यहाँ पे ऐसा क्यों नहीं है. How can we go and tell कि SWD नहीं चलता? Because it is outdated now. But
see, just elaborate on this. What I feel is that see, the whole idea was like to have a specialty clinic. So that is the reason why we have other consultants also. So along with along with us, we have Dr. Aditi with us. She is specialized in neuro. She is a PhD neuro from Canada. So she sees basically all stroke patients. So the kind of knowledge what she has in stroke, obviously I will not have. Even though I've learnt in BPT, but she's a PhD in stroke. Okay, so definitely she'll get the she can give the best patient care. Okay, so our total concept is that like patients should not suffer and they should get the best care. They should be in the best hands. Okay, so that is why we say a center of excellence for physiotherapy, because we want the best people to see the patients. And similarly for geriatrics, we have Dr. Anushri, and like orthopedics, both of us are managing. I'm more into spine cases, and then if it's a sports condition, definitely Rincy will see. So that's how. But it's very difficult because if you look at it in medical people like doctors. See, doctors have the specialty. A gynec will never see a pediatric patient, okay, or a orthopedician will never see a medicine patient. But in our field, I think it will take some more years to create awareness, because see, just to make money, we see, okay, we will take up all kind of cases, okay, irrespective of what is your specialty. I've seen people, okay, even if you're MPT ortho, you will still take a neuro case. Even if you're MPT neuro, they will still practice orthopedics, okay. So this concept has to change. Otherwise, our profession will not grow. That is one thing. That's the biggest thing what I feel. So we have to change this mindset. And people should be aware of that. See, if I have an orthopedic problem, I should go to MPT ortho. If I have stroke, I should go to MPT neuro. So I think in metros still they are aware, but in small towns abhi bhi nahi hai. So I think
metros also itna nahi hai, because they say we need a physiotherapist.
Yeah. So
that is
it is
the
our
language
responsibility.
they use.
Yeah.
They don't tell which specialized physiotherapist do they need, because they are not aware, because everyone practices everything. So that particular mindset we are changing.
And basically even orthopedicians also don't know this. They think all physios are the same. Just to give you an example, today I just met an orthopedic surgeon and he's like, and he has a physio who's practicing for the past many years. Okay. So he was just a bachelor's and he's doing everything. Then he's like, what is special about your physiotherapy? That was his question. Okay. So even they are not aware so much. So it is our duty to create awareness that our field is grown now. Okay, we are into speciality. So that is very, very important. You need to make them understand. So once doctors have awareness, your patients will have awareness. So that is neither the other things. Yeah, we need to create that.
Why do you think the awareness has been less till now as compared to other fields?
Where is it lacking? Is it on our part? Is it on the patient?
I think it is our mistake only, because see, if tomorrow a stroke patient comes to me, I should be fair enough to refer the patient to a neurophysiotherapist, right? So what I do is that no, I will take that case. Okay, that is the main problem. So if you're not a neuro person, you refer the patient to your friend who is a neurotherapist. वैसा नहीं होता है अपने फील्ड में. Whereas in doctors, obviously, they will not do that. They will never do that. So that is how they grow. See, a lot of people practice everything. So that concept should change. So once you finish your BPT, you make up your mind what is your area of interest. Because entire life you have to practice that. So when you choose your MPT subject, be very clear. I was very clear. If I don't get orthopedics, I will not do MPT. I was very clear. See, just because you're getting a seat, you should not take. That is my advice to all the students. Okay. Just because you're getting some specialty, मुझे मिल रहा है neuro, तो I'll take neuro. even though my interest is orthopedics. You wait for 1 year, take a break, work somewhere, and repeat the entrance next year. Okay, so choose what your heart says. Okay, because your entire life you will be doing that specialty. You'll have a stamp that you are an orthopedic physiotherapist or you are a cardio. I was very clear, I cannot work in ICU. I never wanted to work in ICU. And neuro patients were very depressing for me, and you need a lot of patience also to see. And I like black patients. She knows very well. Yeah, okay. So yeah, so that's one thing. So I think you should be very clear in your mind which specialty you want. Pediatrics I cannot handle, so it's very difficult for me to handle kids. Okay, so ortho was my first love. So that is, I think everybody should have an interest. That is how you should decide before you choose your MPT subject. That's very, very important.
Sir, we read that you also have an Onco Physiotherapist, and that is something new that we heard. We aren't quite aware of that. So if you could tell us what exactly that is and how that works.
Onco Physiotherapist, no, it's basically for lymphedema and all, post surgery. I think she can give you
basically
better.
we have a physiotherapist who is actually specialized in cancer rehab. So entire cancer rehab protocol is covered up by her, and plus lymphedema is getting added to it, where only patients with lymphedema issues which have been ignored as general swelling is also being taken into consideration. So that is how we have got oncophysio. Since cancer is growing like anything, there are people suffering with that, and tertiary care management mein we do play a major role on it. So we kind of incorporated that particular physiotherapy also in our setup.
So we wanted to have all specialties under one roof. That was the intention.
Ma'am, what is the process of becoming an Onco Physiotherapist? Like, is that a different specialty or is it a subspecialty or what is
You have MPT oncology. I think as far as I'm aware, MUTS doesn't have, but I think KD Belgaum has it. KD Belgaum has. Manipal also, I'm not very sure whether they have it now. But our times, we never had onco specialty as such. But KD has it. Definitely, because one of my students was doing from KD. So KD has onco specialty, MPT in oncology, Onco Physiotherapy.
So Tata offers a course, no?
Tata offers a short-term course. It is not a degree program. It is a diploma or something. I think it's a diploma,
course.
yeah.
Okay.
But master's program KD has. It's a proper 2 years MPT program.
Like, if you want to hire someone for your clinic, what are the things that you will look for in that person?
See, basically what I look is like they should have a willingness to learn, okay, and update themselves, okay, and hardworking. Yes.
Same thing. That's what dedication is what we require.
Yeah.
Marks, after all, is just on paper.
Marks is okay because see, ultimately it depends on your luck. Maybe you are a good student, your exam went bad. So I don't believe in marks. Basically, I've been a teacher for so many years, but I don't believe in marks. See, learning happens in the classroom, and everyday learning happens. So your one day exam cannot decide your future. Okay, so basically it's a
Actually, the
dedication
mark
and hard
system
work.
has changed also.
Yeah.
Even for the lower classes, I'm talking about first and second. Now it's a continuous assessment program, where every day they are assessed rather than one day deciding your entire future.
Yeah.
Every day they
So
are
there is no
assessed.
exam for my son also. There is no exam in the school. I think in ICSE board, right? They
No,
don't have
in that
exams.
particular
Yeah,
school.
they don't have exams. So they have a continuous assessment thing. So that's a good concept, I
So
feel.
I don't think any clinic looks for marks. No clinic looks for marks. You should be talented enough, willing to learn, dedicated to that particular subject, whatever you're doing, and that's it.
And I think clinical practice means you need good communication skills. That is one important point. You need to have good communication skills. Otherwise, there's no point. You cannot manage a patient. That is very important.
Somewhere the soft skills and the passion is important.
Yeah,
And
passion
true.
and soft
Passion
skills,
is
definitely, and dedication and willingness to work hard, definitely. Lot of mistakes, yeah. I can go on talking on the subject. Yeah. See, mistakes, no, see what I see, our generation and like your generation today, see, students don't want to read at all. Okay, they just want easy tricks. Okay, if you ask a question, they'll simply Google and get the answer. Okay, I think I don't see anybody reading textbooks anymore. I don't know whether I'm outdated or like pata nahi, because I never see people reading textbooks. I hardly see students, even MPT students. Okay, they're supposed to read textbooks. Okay, they have to know. Even if you ask the author name, also उनको पता नहीं है. They have no idea. They will just tell you Google में देखा या Wikipedia or Physiopedia. That is the answer what I get. If I ask them, okay, what's the reference? They have no clue. Okay, कौन से book से लिखा नहीं पता. Okay, so even the textbook name they will not know. So the basic problem with today's generation is that they don't want to work hard. Reading, and that is very, very important. You have to actually read. Okay, that is the only thing what is going to give you knowledge. So nothing worthwhile comes easily. You really have to work hard. Okay, so hard work is the only thing what can accomplish results that last. So that is one thing what I see students ka major flaw. And then second thing is that I think everybody wants to make money even while studying also. So even I've seen, it's a little weird actually, but I have seen second year, third year students going for home visits. They don't know the assessment also. They have no clue about the assessment. Okay, it is still in final year now. Management part comes in final year. Still they are seeing home visits. Okay, so that is somewhere we go wrong. See, I think while studying you should acquire knowledge and really work hard. For that matter, even for PG also, I think the time should be used for studying. See, Manipal was a different thing because we had a campus life. So there was no scope to see patients. And we were not allowed also. Okay. Compulsory we had to be in the library after college hours. Okay. So maximum time we used to read. Okay. Our student life was all studying only. This earning money was never there in our minds because it was not allowed. We cannot see patients. It's a small town. And college is very strict about that. Even the staff cannot see private patients because they are a full-time faculty there. You cannot see cases outside. That is one good thing about Manipal, I feel. Yeah. So they are very much dedicated.
I think is as students, you guys lack focus. Everyone wants to be the master of all. At one particular time, you want to master everything. Like instead of studying, or let's say instead of doing one particular task, at the same time you will try to multitask it. So that is where you think you are the master of all, but you are actually not mastering anything. You are just touching every part of that subject and you are just moving on. Kaam chalane wala thing is going on. That is what is wrong with the generation gap, what we can say. Because we were focused, ki yes, this is to be achieved. But most of this generation is not focused. हो जाएगा, कर लेंगे, ये भी साथ में ले लेंगे वाला attitude is always
very casual attitude. But definitely this generation is smarter than our generation. Yeah, definitely, especially technology.
Technology wise, definitely.
Yeah,
I agree
definitely
with that.
smarter. Nothing worthwhile comes easily. You will have to really work hard. Continuous work, hard work is the only way to accomplish results that last. Definitely. Beat any field. Okay, that is the only thing what I have to tell you. And read books, refer good journals, okay, and update yourself in whichever field you are. That is important. Yeah.
Almost similar. I would say read, practice your speciality so that it is known to everyone, and most importantly have patience. You will earn money, eventually you will earn money, but for that you have to be really good with what you have.